Hello, I'm Laura Andrus, and I will be discussing HIV and AIDS in the Hispanic community. HIV and AIDS is a global issue that affects different people of all cultures, ethnicity, religion, and genders. HIV affects children, women, and men. HIV does not discriminate. People do. HIV only affects humans. It weakens the immune system by destroying important cells that fight disease and infection. Hispanics, Latinos represent the fastest growing population in the U.S. and now the largest minority group. They are affected disproportionately by HIV and AIDS and other sexually transmitted disease. Latino youth are less likely to use condoms and report higher rates of unprotected sex than non-Latino whites. Hispanics bear a large burden of the HIV AIDS status in this country. Hispanics experience higher rates of premature deaths due to AIDS when compared to counterparts in other ethnic or racial communities. In 2012, the Center of Disease Control released that 80% of Hispanics or Latinos were aware of their HIV status. Of those, only 26% have the virus under control. Empowering communities, Hispanics, by educating them on prevention of HIV/AIDS infection and by creating opportunities to choose a healthier sexual lifestyle and to make better choices. Now, globally, the overall number of people living with HIV had increased as new infections occur over each year. HIV-affected adults reported that as a result of HIV stigma and discrimination, they had experienced loss of social support, such as friends, family, and sexual partners. HIV-positive adults also have experienced isolation, job loss, housing loss, automobile loss, and persecution. One of the current policies that I would like to discuss is the Affordable Care Act. 1 in 5, or 17% of people living with HIV, had no private insurance, and nearly 30% did not have coverage. Medicaid, the federal state program that provided health care benefits to people with low income and those living with disability, was a major source of coverage for people living with HIV and AIDS. As of September 2010, insurers are no longer able to deny coverage to children living with AIDS or HIV. The parents of 17.6 million children with pre-existing conditions no longer have to worry about their children being denied coverage because of pre-existing conditions. Because of the law, 105 million Americans no longer have a lifetime dollar limit on essential benefits. In many states, including Louisiana, people living with HIV who meet income of 133% below the federal level poverty line will no longer have to wait for AIDS diagnosis to be eligible for Medicaid. New estimates suggested that 5.4 million Latinos who would otherwise be uninsured will gain coverage in 2016 through the expansion of Medicaid eligibility and the creation of the affordable insurance exchanges. There is an estimate 736,000 Latino young adults now have health insurance coverage because of Affordable Care Act. Compared with Americans, Latinos are less likely to receive care and more likely to have a chronic disease such as HIV and AIDS. The Affordable Care Act helped to make prevention services affordable and accessible by requiring most health insurance plans to cover prevention and wellness with no cost sharing. The law requires insurers to cover HIV screening without cost sharing for individuals at high risk for infection. About 35% of patients served by community health centers in 2009 were Latinos or Hispanics. The Affordable Care Act increased funding available to more than 1,100 community health centers located in all 50 states. The Affordable Care Act increased racial and ethnic diversity of doctors, nurses, and other healthcare professionals. These initiatives will help providers to better address the needs of Hispanic and other minorities and communicate more effectively with their patients. Now, there is one policy that I would like to change. The one that says no contraceptive or abortifacient drug, device, or other similar product shall be distributed in any public school. I would like to have condoms distributed in every public and private school in this community to high school students ages 14 years of age and older. Also, I would like to implement a sexual education class to every high school student ages 14 years of age and older. Empowering is helping people identify course of action, make decisions about which is more beneficial, giving people more power over their own lives. There should be bilingual staff that speaks English and Spanish instructing educational training programs. Changes will cost about $150,000 a year to implement. I would also like to carry out outreach efforts through health fairs and mobile clinics aimed at increasing the number of Latinos or Hispanics being tested. Where would the money come from? The money should come from federally funded grants. Who should support it? Congress, senators, legislators, our representatives, parents, the mayor, the schools. Who would oppose it? Maybe some parents. Will it succeed? Yes. It will be a successful program because this is a very good investment because it can save millions of lives. Human life is very valuable. This investment can enhance and enrich the quality of people's lives. It can enhance the quality of how long it can lengthen people's lives as well. Knowledge is power. Thank you very much.